Hello everyone. Today we are going to learn about National Mental Health Program. Myself Jamika. So let's start with introduction. Mental health is an integral and essential component of health. World Health Organization defines the mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and is able to make a contribution to his or her community. In this positive sense, mental health is the foundation for individual well-being and the effective functioning of the community. Globally, the mental health problems are raising and the burden of illness resulting from the psychiatric and behavioral disorder is enormous. Now we are going to see burden of mental health problems from Indian scenario. In India, how we can say that it is a burden for mental health problem. Lifetime prevalence of mental health disorder in India is about 12.3 for common mental disorders and 1.95 for severe mental disorders. With such magnitude of mental disorders, it becomes necessary to promote mental health services for the well-being of general population, in addition to provide treatment for mental illness. National Mental Health Survey reported an overall treatment gap of 83% of any mental health problem. The treatment gap reported for common mental disorders, 85%, was higher when compared to those for severe mental disorders, which is 73.6%. For substance use disorder, National Mental Health Survey reports a treatment gap of 90%. Now let's see history of mental health services and initiatives. It has been started with Board Committee. The Board Committee report in 1946 stated that the prevalence of mental illness during that period was estimated about 2 per 1,000 general population, and in India had only 10,000 psychiatric beds and 30 institutions for population of over 400 million. In Mudaliar Committee, the Government of India appointed Health Survey and Planning Committee in 1956. Chairperson was Dr. Mudaliar to assess the state of healthcare and review the progress after the implementation of Board Committee's recommendation. The committee submitted the report in 1962 and identified that Srivastava Committee. The Srivastava Committee recommended the Community Health Volunteers Scheme. Community Health Volunteers Scheme were supposed to provide their service to a population of 1,000. They also recommended that one of the manuals of this worker should deal with identifying and managing mental health emergencies and problems. Now let's see about National Mental Health Program. The Government of India launches the National Mental Health Program in 1982, keeping in view the heavy burden of mental illness in the community and the absolute inadequacy of mental health care infrastructure in the country to deal with it. In 1982, we were having a lot of burden of mental illness. So to cope with that, Government of India has started in 1982 National Mental Health Program. The District Mental Health Program was added to the program in 1996. The program was re-strategized in 2003 to include two schemes: modernization of state mental hospitals and upgradation of psychiatric wings of medical colleges or in general hospitals. The Manpower Development Scheme A and B become a part of the program in 2009. So let's talk about components. There are three components. First is treatment of mentally ill person, rehabilitation, and prevention and promotion of positive mental health. So let's start and we'll see one by one these components in detail. First is, then we are going to see the aids, prevention and treatment of mental and neurological disorders and their associated disabilities. Use of mental health technology to improve general health services and application of mental health principles in total national development to improve quality of life. Now we are going to see the three components which I told you earlier. The first one is treatment in detail. Village and sub-center level multipurpose worker and health supervisor under the supervision of medical officers to be trained for management of psychiatric emergency. Medical officer is supposed to train a village and sub-center level multipurpose health worker to management of psychiatric emergencies, administration and supervision of maintenance treatment for chronic psychiatric disorder, diagnosis and management of grand mal epilepsy, especially in children, liaison with local school teachers and parents regarding mental retardation and behavioral problems in children, and counseling in problems related to alcohol and drug abuse. So this we have to do. Multi-purpose health worker need to find out all those problems in village and sub-center level. Medical officer of primary health care health center aided by attempts to be trained for supervision of multi-purpose workers' performance, elementary diagnosis, treatment of functional psychosis, treatment of uncomplicated cases of psychiatric disorder associated with physical disease, management of uncomplicated psychosocial problems, and epidemiological surveillance of mental morbidity. Next is district hospital. It was recognized that there should be at least one psychiatrist attached to every district hospital as an integral part of the district health services. The district hospital should have 30 to 50 beds. Psychiatric beds should be there, minimum 30 to 50 in each district hospital. The psychiatrist in the district hospital was envisaged to devote only a part of his time to clinical care and greater part in training and supervision of non-specialist health workers. Next is mental hospitals and teaching psychiatric units. Major activities of this higher centers of psychiatric care includes help in care of difficult cases. Next is teaching, and third one is specialized facility like occupational therapy unit, psychotherapy, counseling, and behavioral therapy. Rehabilitation. The component of this sub-program includes treatment of epileptics and psychotics at the community level and development of rehabilitation centers at both the district level and higher referral centers. Prevention. The prevention component is to be community-based with initial focus on prevention and control of alcohol-related problems. Later on, problems like addictions, juvenile delinquency, and acute adjustment problems like suicidal attempts are to be addressed. Next, we'll see objectives. What are the objectives of National Mental Health Program? To ensure the availability and accessibility of minimum mental health care for all in the foreseeable future. To encourage the application of mental health knowledge in general health care and in social development. To promote community participation in the mental health services development, and to enhance human resource in mental health subspecialties. So these were the objectives of National Mental Health Program. Now what are the strategies? The integrated mental health with primary health care through National Mental Health Program. provision of tertiary care institutions for treatment of mental disorders, eradicating stigmatization of mentally ill patients, and protecting their rights through regulatory institutions like Central Mental Health Authority and State Mental Health Authority. Specific approaches: diffusion of mental health skills to be periphery of health services, appropriate appointment of tasks, equitable and balanced distribution of resources, integration of basic mental health care with general health services, and linkage with community development. So this was a specific approach. Now we are going to see how National Mental Health Program affecting district and sub-center level activities. So first one is NMHP developed a program of operationalization and implement the National Mental Health Program in district. District Mental Health Program was launched in 1996 with an aim to achieve the objectives of National Mental Health Program. So why we have created National Mental Health Program is we can fulfill our objectives which we have created in National Mental Health Program at district level. Pilot project of District Mental Health Program was done at Bellary district in Karnataka. The main objectives of District Mental Health Program were to provide sustainable basic mental health services in community. Why we have started District Mental Health Program is to provide a basic mental health services at community level and integration of these with other services. Early detection and treatment in community itself to ensure ease of caregiver, to take pressure of mental hospitals. Mental hospitals should not burden. We can treat few disorders at district level as well. So the pressure will be less in mental hospitals. So to take care pressure of mental hospitals, to reduce stigma and rehabilitate patients with the community, to detect as well as manage and refer case of epilepsy. District Mental Health Program strategies. First one is service provision, outreach component, sensitization and training of health personnel, awareness camp, and community participation. So let's see service provision. Provision of mental health, outpatient and inpatient mental health services with a 10-bedded inpatient facility. Outreach component, satellite clinics, 4 satellite clinics per month at community health centers, primary health centers by District Mental Health Program team. Targeted interventions, life skills education, counseling in schools, college, counseling services, workplace stress management, and suicidal prevention services. Sensitization and training of health personnel at district and sub-district level. Awareness camp for disseminations of awareness regarding mental illness and related stigma through involvement of local faith healer, teachers and leaders, etc. And community participation, linkage with self-help group, family and caregiver groups, and NGO, non-profit organization working in the field of mental health. Sensitization of enforcement officials regarding legal provisions for effective implementation of Mental Health Act. How in community health services, what are the services are available? So outpatient services and inpatient services for emergency psychiatry patients and counseling services. Manpower medical officer will be there, clinical psychologist or psychiatric social worker will be there. Next, in primary health center, services which are available, outpatient services, counseling services in assessing social care benefits, proactive case finding and mental health promotion activities, and manpower community health workers too will be there. Mental health services. Mental health services will be delivered through government mental hospitals or medical colleges, hospital with Department of Psychiatry. under the overall supervision of the head of psychiatric department. Mental health helpline, a country-wide 24 hours dedicated helpline to provide information to public on mental health resources, emergency situation and crisis management, information pertaining to destitute mentally ill patients, registration of complaints of human rights violation of mentally ill and assistance on medical legal cases. This helpline will help to register the complaint when human rights violation happens or when any medical legal issues arise, and if you need an assistance, so you can contact this medical health helpline. Linked with district hospital, this medical helpline is linked with district hospital, medical college hospitals, mental hospitals, private mental health facilities, NGOs, and all other mental health services providers of the state. Next, mental health information system, an online data monitoring systems, and will also facilitate bilateral communication between participating units. It is expected to bring significant improvement in the implementation, as there shall be possibility of mid-course correction based on the feedback. Limitations. So we have seen the benefits, or we have seen the work, we have seen the objectives, aims, strategies. So based on that, we have few limitations of National Mental Health Program, which is, the first one is, the program emphasized more on curative components rather than the preventive and promotive components. Role of support of families in the treatment of the patient was not given. Short-term goals were given priority over the long-term planning, and the administrative structure of the program was not clearly outlined. So these were the limitations. Now we will be seeing current situations, how the mental health facilities, services, how it can affect in this pandemic, which is COVID-19, coronavirus. We all know today's global problem, we can say. So how to care for your mental well-being during COVID-19? So let's see. Keeping all staff protected from chronic stress and poor mental health during this response means that they will have a better capacity to fulfill their roles. Be sure to keep in mind that the current situations will not go away overnight, and so one should focus on longer-term occupational capacity rather than repeated short-term crisis response. Ensure availability of essentials, generic psychotropic medications at all levels of healthcare, which is very important. People living with long-term mental health conditions or epileptic seizures will need uninterrupted access to their medications, and sudden discontinuation should be avoided. During time of stress, pay attention to your own needs and feelings. Engage in healthy activities that you enjoy and find relaxing. Exercise regularly. Keep regular sleep routines. Eat healthy food. Keep things in perspective. Public health agencies and experts in all countries are working despite the outbreaks to ensure the availability of the best care to those are affected. Stay home, stay safe. So today we have seen National Mental Health Program when it has been started in 1982. Then we have seen the components, three components: treatment, rehabilitation, and prevention. Then we have seen the aims of National Mental Health Program, then strategies, then objectives. Then we have seen District Mental Health Program, how that helps in sub-central level and district level, we have seen that, and at last we have seen like how we can take care of our mental health well-being during COVID-19. So thank you.